During Chinese New Year, Taiwanese actress Barbie Hsu passed away in Japan, allegedly because of a flu causing pneumonia. But there are other reports which say the true cause of her death is sepsis. Of course, for us who have no access to her medical record, it's very difficult to say for sure what's the true cause of her death. But I want to explain a little bit about sepsis. I suppose a lot of people do not have adequate understanding of what sepsis is, but it is a very important problem. Actually, everyone has the possibility of having sepsis in their life. So let's dive right into it. Now, our body is equipped with a mechanism by which we can fight off invading pathogens like bacteria or viruses. This is our immune system. We have red blood cells in the immune systems which can fight off any invading pathogens. These red blood cells, some of them can secrete antibodies which can target the invading germs and viruses. And some of the cells will secrete proteins, or what we call cytokines, which can coordinate different components of the immune system so that they can work together effectively. Now, normally, if you are healthy, if you are young, then even though there is an infection, like for example in this case, if there's flu, the immune system will be enough to fight off the infection. Of course, during the process, you might be feeling a bit of discomfort, you might have a bit of fever, chills, muscle pain. Those are the signs when our body's immune system is working for us. So after a few days, you'll be perfectly okay. But in case of weakened immunity, like for example in the elderly, in the very young, or in people with long-term diseases like diabetes, then the body defense system is not working well. Or sometimes if the invading germ is very strong, like a bird flu virus, in that case, the body's defense system, the immune system, will not be able to handle the infection. So after a while, the germs causing the infection will be dividing fairly quickly, and they will try to spread to all the major system in our body. Our body at this stage will sense there is a very dangerous threat which is imminent. Under these circumstances, the body defense system will try every means to contain the infection. The red blood cell will work like crazy, and I'm sure some of you have heard about a cytokine storm. Now, when the infection is running out of control, cytokine storm will ensue. That is to say, the cells, the red blood cells in our immune system will be secreting all the cytokines it has, trying to fend off the infection. This crazy, uncontrolled secretion of all the cytokines at the same time, of course, some of the cytokines will help us to kill off the invading germs. But at the same time, these cytokines will also attack our bodies. It will also severely jeopardize the functioning of all our vital organs and systems. Now, one of the problems is that there will be widespread dilatation or widening of blood vessels in our bodies. We only have a certain amount of blood in the cardiovascular system. If there is a sudden or widespread dilatation of blood vessels, the blood pressure will fall significantly. That is to say, there is a lack of blood supply and oxygen supply to all the vital organs. If that is not corrected promptly, it will cause sequential shutdown of all our vital organs. Of course, that's very dangerous. Now, what I describe is the basic mechanism of how sepsis occurs. It is more commonly seen after bacterial infection, but it can occasionally follow viral infection like flu infection as well. Actually, sepsis is the common consequence of any infection that is not contained. For example, if there's any significant infection, like some people may have pus collection in the biliary tree, if there's a gallstone, or the people can have pus collection in the kidney if they have kidney stone. The germs in the pus will go into the bloodstream causing sepsis. We normally fear when a patient after an operation develop high fever which is not controlled, or if they develop low blood pressure, that will be an indication there might be severe infection in the wound. It's likely to develop into sepsis, which comes with a very high mortality. Even though the patient is lucky to survive, there might be severe consequences like amputations or may become disabled after sepsis. That's about it today. I hope you learned a little bit about sepsis. Thank you very much for listening. I'll see you in the next one. Bye.